Good afternoon and welcome to today's session as part of the Virginia Hospitals and Healthcare Association's Brown Bag webinar, series of webinars supporting safety culture and high reliability in Virginia hospitals and health systems. My name is Abraham Segrist, and I'm the Vice President for Quality and Patient Safety here at the Association, and I'm glad to be hosting this session this morning. As most of you who've been involved in these events know, that one of the primary objectives is to highlight activities occurring within Virginia hospitals that promote a safety culture and promote preventing harm to our patients. Today's webinar and next month's webinar will focus on another important area of harm, and that is harm to our staff and our providers who work in Virginia hospitals and health systems. And so we're glad to be able to not only support protecting our patients from harm, but also protecting our staff from harm. And we're glad to have our colleagues from Carilion Clinic who will review an initiative that they're involved in focused on keeping home health nurses safe in their jobs. Next slide. So a couple of housekeeping comments before we get started. The slides for this morning's presentation, for this afternoon's presentation, were sent by our colleague Teresa Lindemood this morning. So you should have a copy of those in your inbox. If for some reason you did not receive the handouts, please send us an email and we'll get those sent to you. Our webinar is being recorded this morning, and so if you have colleagues who are unable to join us, they can access today's webinar via recording that will be sent out after the meeting and also posted on our website. We have a fairly ambitious agenda this morning, and so we're going to ask that if you have any questions, please submit those through our chat box, and we will entertain all questions at the end of the chat box. So instead of raising your hands today, simply type the question in the chat box and we'll get to the questions at the end of the presentation. So without further ado, it is my honor to introduce our speaker for today, Ms. Tracy Stewart, who's the manager for home care with Carilion Clinic based in Roanoke, Virginia. So Tracy, welcome, and I'll go ahead and turn the presentation over to you.
Thank you, Abraham, and good afternoon to everyone joining the webinar today. I'm really excited to be here with you for the next 30 minutes as we solely focus on staff safety in the home care environment. As Abraham said, my name is Tracy Stewart, and I have had the privilege of working in home care since 1996. I personally think it's an exciting time to be in home care as well as a challenging one. If you have been in the industry for any length of time, whether it be years or even for just a few months, I know that we can all agree that home care presents unique safety risks for our staff. The goal of this webinar is to share our journey as a home care agency to promote staff safety and how we have tried to wrap our arms around the environment in which we work. There are 4 objectives of the webinar that are listed on the screen. First, we'll be discussing the prevalence of safety issues in the home setting. Next, we'll be taking a look at the 4 pillars of concern that have emerged based on literature reviews. We'll be reviewing the action steps Carilion Clinic Home Care has implemented to promote staff safety, and then I'll summarize our top focus areas and helpful tips to get you started. Based on literature reviews, I have found 4 main pillars of concern related to staff safety in home care. These pillars are the prevalence of home care violence, contributing factors, underreporting of safety concerns, and the need for policies and violence prevention education for staff. These 4 pillars, as you'll see, are the foundation of the safety program that we have implemented here at Carilion. We'll be taking a closer look at each pillar, and I'll be reviewing the action steps and best practices that we have implemented to address each one. But first, let's start off by having a frontline reality check. By providing care in patients' homes, we face a unique and dynamic work environment which moves the locus of control away from us, the healthcare provider. In contrast to our hospital-based counterparts, we often work alone and interact with other people residing in or visiting the patient's home, which could pose a risk to our personal safety. We work in a variety of home settings, and this exposes our employees daily to unpredictable working conditions. Safety issues that could arise range from traveling in inclement weather, unsanitary homes, aggressive pets, to verbally and physically abusive patients and caregivers. Given the solitary nature of home care work, employees may find themselves in vulnerable situations where their personal safety could be at risk. I know that this statistic is a few years old, but every time I read it, it's a sobering realization of the vulnerability of our home care staff. In my research, I found that according to the U.S. crime statistics from 2010, home care nursing was the second most dangerous occupation in the United States, second only to law enforcement. One of the main reasons why is that having a mobile workforce increases the risk of violence in home care, just as it does for police officers and taxi cab drivers. Statistics are showing us that the majority of violent crimes are usually committed near an employee's car. This could be because workers may be unaware of their surroundings, they're on the phone, or simply in a hurry. The National Institute for Occupational Safety and Health conducted research back in 2009 on behalf of the CDC to assess the risk of violence for home care workers. The results of their research showed that almost half, 48% of the registered nurses surveyed reported that they had 3 or more stressful conditions in their current caseload, such as known neighborhood violence, drug use in the home, and unsanitary conditions. There are many other statistics and surveys that I could share, but this is confirming what we already know, and that is home care safety is a real issue, and our staff are exposed to risky situations. So let's get started and take a deeper dive by looking at the 4 pillars of concern and the development of Carilion's safety program. The first pillar of concern is the prevalence of home care violence. To address pillar number 1, we decided as a leadership team that we needed to hear directly from our staff. We needed to get an idea of what kind of safety issues they were encountering and what types of things were making them feel uneasy. I may have had a good idea of some of the safety concerns being the manager, but my view in the office is very different from those in the field. We developed a safety survey that was distributed to all our home care and hospice staff. The results of our internal survey was really eye-opening. It was enlightening to see the results of our own team in black and white, and the results of polling our staff told us exactly where to start and what we needed to focus on first. This next slide highlights what our staff survey looked like. We broke the survey out into 2 categories, visiting staff and non-visiting staff, because we wanted feedback from our support staff in the office as well. As you can see, the survey was short with only 7 simple questions. However, the information we received from this survey truly is the foundation of our safety program. Again, it showed us where to start, what to focus on, and it helped us shape our safety protocols and develop staff education. This next slide highlights some important feedback areas we obtained from our survey, and to be honest, the stats did shock me a little. Almost half our staff here at Carilion, 49%, responded that they had left a home early due to a safety concern. This was surprising to me, as obviously it was happening more often than what we realized. The most common reasons for leaving early was due to staff having concerns about patients smoking while actively using oxygen. The staff member just had a gut instinct to leave. They were witnessing active drug use, or they experienced verbal or physical abuse while in the home. 60% of our staff responded that the things that caused them the most uneasiness or fright was gang-related activity, infestations, biting dogs, unsecured guns, flirty family members, and working in areas with no cell coverage. The survey also showed us topics that staff wished they knew more about. Again, this feedback shows us what to focus on. It was our starting point with tightening up our protocols and the development of our staff education. Now that we had the results from our internal survey, we focused on the second pillar, contributing factors. In our reality check a few slides back, we touched on contributing factors a little already, but the reality is that home care workers are at an increased risk for violence due to not having a secure and consistent location for their workday. Home care nurses also work on call, which presents dangers in itself with traveling to see patients late at night or in the early morning hours. We all know that having a mobile workforce is challenging. To address this second pillar, we focused on two things. We created and implemented an after-hours check-in procedure, and we also changed our name badges. One of the things that kept us up at night as a leadership team was not knowing when our on-call staff had been called out for a PRN visit and not knowing if they made it home safely. We felt like there needed to be more of a secure process with better oversight to ensure our on-call nurses were safe, and if they weren't, then we would know about it. So we created an after-hours check-in procedure. In a nutshell, if our on-call nurse gets a PRN visit after hours when the office is closed, the nurse calls to check in with our hospital switchboard. The nurse gives the operator her cell phone number, the address she's going to, and the anticipated amount of time she is expecting to be in the home. The operator then sets a reminder to alert them when they should be getting a call back from the nurse. Once the visit is over, the nurse checks back in with the switchboard. If the nurse doesn't check back in with the switchboard, the operator will try and call the nurse 2 times. If still no answer or response from the nurse, then the local police will be notified. This simple but effective check-in procedure has enhanced the safety of our after-hours staff. To also address contributing factors, we took a look at our name badges, and all field staff were issued a new badge that reflects just their first name and last initial only. We obtained consent from our legal teams to do this because of the independent work that we do and because our work occurs in areas of our community that are remote and or have a higher crime rate. Unfortunately, we have had patients contact nurses inappropriately over Facebook. Since we have changed our name badges, this has not occurred. If a patient asks the nurse what their last name is, they simply redirect the conversation by saying something like, oh, it should be Carilion, or I'm just Nurse Tracy, or Tracy Nurse. Learning to set these types of boundaries has been an important part of our journey with staff training. The third pillar is underreporting of safety concerns and has been an area that we have focused a lot of time on. In my experience, I have found that most field staff simply feel that safety risks are just a normal part of their job. Some home care workers may call verbal abuse violence, while others feel it just goes along with the territory. This oftentimes leads to issues being underreported. Employees should feel safe and encouraged to report unsafe conditions and any violence, both verbal and physical. We've developed a culture on our team of saying, just report it. Report it for your own safety, report it for your fellow coworker, report it for your team. Report any inappropriate or suspicious behavior. This next slide highlights three main things that we have implemented to address the underreporting of issues. First, we created our Home Care and Hospice Safety Coalition. This is a multidisciplinary team that meets monthly with our system's chief of police. We held our first meeting in May of 2016, and over the last 2 years, we have problem solved over 200 safety issues, ranging from an over-friendly dog to a patient's neighbor actually shooting a firearm in the direction of one of our nurses. The creation of this team has helped empower our staff to report issues, and again, we meet monthly and pull up as needed. Secondly, we implemented safety logs to track and trend safety occurrences. I have found that this really is a best practice to have a safety notebook to record issues, just like we do with our complaint logs. Keeping this notebook helps you see trends that may be occurring in certain locations or neighborhoods that you might not have otherwise realized. It's also a great learning tool. There have been many times I've gone back to the logs to see how an issue was problem solved when a similar one reoccurred. Next, our home care leadership has access to an emergency alert system. This allows our leadership team to send mass notifications to staff to inform them of any issue out in the community that needs to be communicated quickly so that they can avoid that particular area. There are many emergency alert systems available. Everbridge just happens to be the one that we use as a corporation. The fourth pillar of concern is the need for safety policies and violence prevention education. We have spent a lot of time in this area as well. Our safety team explored education inside and outside our system. We found that we had excellent tools and in-services addressing safety as a system, but most were geared towards an inpatient setting and didn't really fit into the home care environment. So when we didn't find training that met our specific needs, we developed our own. We sought out a person in our community who was an expert in the field of personal safety, and through this collaboration, we developed a 4-hour safety workshop. This workshop was the first ever of its kind, geared solely towards the safety needs of our home care staff. The course focused on situational awareness, personal boundaries, and physical skills. A key area that we have focused on as an organization is training our staff to recognize risky behaviors and situations. I encourage you, as you move forward, explore what's out there in your community. We are very blessed as an organization here at Carilion to have our own internal police department, and we have partnered with them to problem solve complex safety issues. I would recommend, if you don't have an internal police department or security team, reach out to your local law enforcement agencies to seek guidance and support on the issues you are facing. Local colleges and civic organizations often have safety training as well. Reach out to them to see what resources they might have, or partner with them to help you develop something specific to meet your team's needs. Here are some pictures from the first safety workshop that we held, and to have the opportunity to develop and tailor a workshop to meet our specific home care needs has been truly valuable. Staff left the training feeling empowered and had tangible tools to help them in their day-to-day practice. I think it's also been empowering for our staff to know that even though they are a guest in a patient's home, they are there to provide a professional service, and they have the right to work in a safe environment. One of the biggest things we found as an organization is that we struggled with setting boundaries, and setting boundaries with our patients and anyone else who may be in the home is extremely important. In the development of our training, our community expert helped us create boundary phrases that we could use in homes during certain situations. Again, we learned that setting boundaries is a must and a critical element in keeping staff safe. During our training, we practice setting boundaries. For example, if a patient made an inappropriate comment, staff could say, "Those comments are not for Carilion staff." For inappropriate behavior, our response would be, "Please be civil or I will have to leave, and I really don't want your mom to lose her service." Blocking of a doorway, staff can state, "Please keep the doorway clear. It is Carilion's policy that doorways are not blocked." Along with our in-classroom training, we also created a safety newsletter for our service line. 3 editions have been created thus far, and here is what our first newsletter looked like. Each newsletter covers safety tips and reminders from Carillion's Chief of Police. It includes a what-if scenario, which is an outline of an actual safety situation we problem solved with recommendations to keep staff safe. The topics for our newsletters are handpicked based on the feedback we received from our safety survey. In this edition, as you can see, we covered how to manage aggressive pets with helpful info for the staff, and we also covered tips for working in an area without cell phone coverage. With our continued focus on safety, we created a code word for staff to use if they are on the phone with the office and are in need of help. Our code word is calling Dr. Strong. Our clerical staff have been trained that if a clinician calls and uses the word Dr. Strong in their communication, then they are in need of help and 911 will be called. I have also heard of hospitals using the code word NORA, which stands for Need Officer Right Away. We always encourage our staff to call 911 first, if at all possible. We've also focused on the safety of our office staff by having active shooter training for them and anyone else and everyone else on our team. We've developed safe rooms in the office where the doors can be locked from the inside, and we've identified a safe location off campus just down the hill as a common area for our staff to meet in case we had to evacuate the building. To promote staff safety, our security department has provided safety whistles to our team. It may be simple, but they are quite effective if you are walking alone or out at night. It could be just enough to startle a person or signal for help if you were in a bad situation. We are constantly looking at resources and technology. A subcommittee is exploring what's out there in the form of technology to enhance staff safety while out in the field. We are currently evaluating smartphone apps, panic buttons, and devices with GPS capability to locate an employee in distress. Our work as a safety team has created updates to our security and emergency management policies. We've also developed safety protocols, such as in certain situations, if an employee witnesses suspicious behavior, drug paraphernalia, bad behavior, or is assigned to a patient with a known or suspected criminal history, our police department will investigate the situation and offer ideas on how to safely care for the patient. For example, some recommendations may be that staff need to visit the home in pairs. Staff are to check in and check out with each visit. Staff may need to go as early in the day as possible, or some locations may not be safe at all based on the criminal history of that area. In those scenarios, we work directly with the doctor and the patient to find an alternate care location. Our police department has even escorted us to home visits when needed. We've also developed an oxygen safety contract and a behavioral contract to help enforce boundaries when risky situations or inappropriate behaviors have been identified. So this has been a high-level overview of the components of our safety program here at Carilion. And you may be asking yourself right now, where do I start? At times, it may feel like you have bitten off more than you can chew, and my only advice is to just keep chewing. It takes time. Staff safety in the home care environment is complex, but even the smallest steps can create big change. Start with just one thing that you can implement today to promote the safety of your staff. It could be something as simple as developing a stress code word, issuing your staff a safety whistle, or creating a safety log notebook. This next slide highlights my top 5 recommendations to get you started based on my own experience and literature reviews. First, start where you are. Poll your staff and find out the safety issues they are facing. Number 2 is leadership support is a must. Leaders need to be on the same page and acknowledge safety issues. You need your leader's support to work within the parameters that you have. Next is identify a champion who will help you lead the way with implementation and training, a champion that has a passion for safety. Number 4 is seek out a local expert in personal safety. Reach out to security where you are or local law enforcement to develop a partnership and assist with creating staff safety protocols. And finally, create a safety team. Let your staff know about it. Encourage them to report issues. Given the fact that violence is underreported in home care, employees should feel safe and encouraged to report any safety concerns. In summary, this has been a journey. I think the work of the Coalition has empowered our staff here at Carilion to report issues and speak up to promote the safety of everyone. It has also given our staff an awareness that even when working remotely, they are entitled to a safe environment. In closing, start where you stand and know that not everything that is faced can be changed, but nothing can be changed until it is faced. Thank you.
Tracy, that was absolutely wonderful. That was an excellent presentation. We're checking the chat box now to see if there are any questions from our attendees. And as we do that, we'll remind folks that if they do have a question, simply go to the chat box section of the webinar and type in your question. Tracy, I was particularly impressed by the protocol in which the operator calls the nurse if the nurse hasn't called at the designated time. That was very, very impressive. And also the work you guys have done to create specific language that the staff can use when they get in an uncomfortable situation. Sometimes staff know that it's a bad situation but aren't quite sure what words to use, and in these situations, words often can either calm a situation or escalate a situation. And the work that you guys have done to create language that the staff can tap into is quite impressive. So congratulations on great work.
Thank you, Abraham.
Teresa, do we see anything in the chat box?
No, we do not have any questions or at this time.
And I'm not surprised because the presentation was so thorough and comprehensive, but fortunately, we appreciate the fact that you guys have listed your email and telephone contact in there, so I wouldn't be surprised if folks from across the state are reaching out to you all.
Okay.
I guess one final note, go ahead.
I would encourage anyone, feel free to reach out to me. You have my contact number and my email. I would be more than happy to talk to anyone who is, like we are, trying to wrap our arms around this complex environment that we're working in. So please feel free to reach out.
I encourage everyone on the line to take advantage of that opportunity, and sort of repeating Tracy and repeating James Baldwin. Not everything that is faced can be changed, but nothing can be changed until it is faced. So thank you very much for that, Tracy. Thank you for the presentation. And once folks log off the presentation, they will get a brief questionnaire that will ask for feedback. We're at the top of the hour, and so we will let you guys get to the rest of your day. Thank you all for joining us, and again, thanks to our colleagues at Carilion for an excellent presentation.
Thank you so much. Bye-bye.
Bye-bye.
That was very good.